Thanks to feedback from you and the community of Brias offices, we have engineered custom brackets and pads to offer a number of improvements for you and your patients. The custom pads offer increased surface area and a customized snug contact for each tooth. This improves bonding efficiency, decreases the debond potential the first visit and subsequent visits, and ultimately leads to a smoother bonding session, saving chair time for you, your staff, and your patients. For the most efficient bonding experience, follow these steps. First, we will prep the lingual side of each tooth. Prophy, rinse, and dry. Step 2. Sandblast, rinse, and dry. 3. Etch, rinse, and dry. Finally, apply Assure Plus bonding resin to each tooth. Lightly dry with air and light cure. Note that light curing the Assure Plus will help to avoid transferring Assure Plus to the bonding tray. Getting Assure Plus on the tray could adhere the tray to the teeth and be more difficult to remove. Now, prepare the brackets for bonding. The custom brackets arrive in their digital bonding trays, or DBTs. First, ensure they are fully seated in their proper position. Clean each pad with acetone and allow to air dry. Apply adhesive to each bracket and butter into the pad using a micro brush. Ensure the correct amount is used, not too little and not too much. For brackets with a non-custom flat pad, we recommend a higher viscosity adhesive such as Transbond Plus. For custom brackets, use a low viscosity adhesive. We recommend Transbond Supreme LV. Seat the digital bonding tray and partially cure in a sweeping motion, avoiding curing for too long in any one spot. Remove the tray and fully cure each bracket. The bracket has been designed to improve bracket opening and engagement. While the opening and closing mechanism is similar to the standard flat bracket, there have been several key improvements. When seating the arm into the bracket, an audible and tactile click can be observed. This seat momentarily secures the arm into the bracket while the clips are closed. You can either use the Weingart or bracket opener tool to seat the arm. The clips easily close with a squeeze of the Weingart. Avoid squeezing the positive stop, as doing so may make opening the bracket more difficult. The new design of the clips leaves a gap between the clip tips and the bracket pad, even when the clip is completely closed and has secured the arm. The gap is designed to make it easier to insert the bracket opener when opening the clips. Insert the bracket opener toward the midline of the bracket and rotate to the distal for easier opening. Note the clip is fully closed even though the clip may not appear to be fully seated against the pad. This is by design. A positive stop has been added to the bracket design to make it less likely for the clips to open during normal patient activities, including chewing. The positive stop also prevents over-opening of the clips during arm engagement. It is important to avoid squeezing the positive stop when closing the brackets, as it will not aid in closing the clips and will prevent the clips from opening. Tooth numbers have been added to each bracket to improve identification if needed for rebonding. In addition to the standard width brackets, we have added narrow brackets that can be used in cases with limited surface due to crowding. The software will automatically select these narrow brackets as needed. Thanks for being our partner as we create a billion smiles together.